Back labor is every laboring woman's worst nightmare, or maybe you've never even heard of back labor before. In this video, I'll explain what exactly fetal position is and why it matters, and 3 things that you can do to optimize baby's position in the womb. I'm Annabelle Carney, and I love helping mamas just like you have a better birth experience. So if you're new to my channel, thank you so much for stopping by, and don't forget to hit that subscribe button and ding that little bell down below. So there are several different positions that your baby can be in, and some are better for vaginal birth than others. And I won't be going over every single position, but I do want to talk about the common fetal positions that we often hear about, which is LOA, which is left occiput anterior, and OP, occiput posterior. So LOA is where baby is head down with the back towards mama's left side, looking inward towards mama's spine. Now you may have heard that LOA is the best position for your baby to be in, and this likely comes from the belief that the uterus is slightly more curved on the left side and slightly steeper on the right side. So baby has more space to settle into, and the left side of the uterus encourages baby to tuck their chin, allowing for a more smaller head circumference to enter the pelvis. So what is really the best position for baby to be in? For a smoother vaginal birth, any head down anterior position, whether that is left or right, is an ideal position. So when baby's positioning is head down, it allows baby to flex their head and tuck their chin for proper engagement in the pelvis. And an anterior position just makes it easier for baby's head to navigate through the birth canal as they do their cardinal movements, or what I like to call as baby's dance through your pelvis. Now, when talking about posterior positions, baby's spine is up against mama's spine, so they're facing your front, and the back of their head is towards your back. Baby can either be left occiput posterior or right occiput posterior. Then when babies enter the pelvis in this occiput posterior position, women can feel more discomfort during labor because baby's chin isn't as tucked as it should be. During these contractions, the fetal head presses against mama's spine instead of towards the front where the cervix is. And this position is likely the reason you may have heard a friend, or maybe you've experienced pain across your low back during labor instead of feeling the strong sensations in front of your abdomen. This is referred to as back labor. Now, babies are constantly flipping and moving around in the womb, and it's not actually until about 32 to 36 weeks where they settle into their final position for birth. But one thing to keep in mind is that baby's position is not random, but rather a response to the space that's available to them. And there are multiple factors that influence baby's position. So for instance, the size of your placenta and where it attaches and grows in your uterus can influence the space that your baby has. So with my first baby, I had the typical posterior placenta, and baby was head down and LOA by 30 weeks. And I'm now 32 weeks pregnant with my second baby, and for this pregnancy, I have an anterior placenta. And that's where the placenta is attached to the front of my uterus, and this location could just encourage baby to position themselves a little bit more posterior because the placenta acts as a little cushion as it takes up a little bit more space in the front. So you will typically find out the position of your placenta during your 20-week anatomy scan, and the texts don't really say much, but you can always ask, or just wait until your next prenatal appointment and ask your provider during one of those visits. Now, there really isn't anything to worry about if you do have an anterior placenta like me, but it can be more annoying. So for instance, you'll feel kicks likely later in pregnancy as compared to someone without an anterior placenta who feels some movement as early as 17 weeks. And I was about 21 weeks-ish when I was finally able to feel some movement, which was exciting. It can also make belly mapping harder to do because the placenta cushions any movement in the front, so it might be difficult to tell exactly where baby is in the womb. Also, I was able to find a study that showed some correlation between anterior placentas and babies in the occiput posterior position. And I'll link that study in the description box down below if anyone wants to read more about it. But in any case, an OP presenting baby is not an emergency, but could cause labor to be longer and more uncomfortable, especially for my mamas going unmedicated because of the back labor that often accompanies it. So right now, baby boy is moving around a lot still because his kicks are really all over the place. So I know he hasn't settled into his final position just yet. And to be honest, one of my worries was having an anterior placenta because of the back labor, and that's just one of a fear of mine. But instead of constantly worrying about baby not being in the most optimal position, I am just trying to focus on having a more positive mindset and focusing all my energy on ensuring that baby's path to rotate in my pelvis is clear. So for this pregnancy, I'm very adamant about trying to minimize any musculoskeletal obstacles that could be in his way. So my daily routine in the third trimester is centered around releasing the uterine ligaments, relaxing my pelvic floor, and just making sure that every level of my pelvis can open and move freely. Now, a while back, I did post a video about the 5 movements to help labor progress, and in that video, I go over baby's dance in the pelvis and movements to open up the 3 different pelvic levels. So you can watch that video right over here. Also, the Spinning Babies website has a lot of great info on balancing the womb and body in preparation for birth, and I'll link that website down below. So because our position during pregnancy and birth has a strong influence on fetal positioning in the womb, I've been mindful of my own position throughout the day, especially in the third trimester. So here are 3 things that I am doing daily in the third trimester, and I think is something that you can benefit from as well. So first things first is having good posture. It's super important to sit or stand with your back straight and your rib cage lifted off of your midsection. And also, a lot of us tend to favor this anterior pelvic tilt, especially as we get towards the end of pregnancy and our belly becomes heavier. But really try to be conscious of how you're standing, because that can not only influence baby's position, but it can also contribute to some tightness in your pelvic floor. And we need a nice and supple pelvic floor for birth. So aim to stand tall with your pelvis in a neutral position. And I like to incorporate posterior pelvic tilts either on a birth ball or hands and knees, similar to like a cat-cow in yoga. I'm also being mindful of how I'm sitting, so making sure that I'm sitting up on my sits bones and not on my sacrum. And this is especially important when you're lounging on the couch. So in my third trimester, I usually try to sit on a firm exercise ball that allows my hips to be level with or higher than my knees. And yes, size does matter. So if you are 5'4" and under, a 55 centimeter ball works great. Or if you're 5'4" to 5'10", you'll get a 65 centimeter ball. And if you're 5'10" and over, you'll get a 75 centimeter ball. But if I really want to lay on the couch and watch TV and just relax, because let's be real, the third trimester can get pretty exhausting. I avoid laying on my back or even semi-reclined, and I choose a side-lying position instead and put a pillow between my knees and my ankles to maintain alignment. And lastly, I get into some gravity-dependent positions every single day, whether that is forward leaning on a birth ball, holding a puppy pose for a few minutes, or a more intense position such as the classic Spinning Babies technique, forward leaning inversion off the side of my couch. I love the forward leaning inversion to help release the lower uterine ligaments, and I almost instantly feel some kind of relief when I'm done. And also with the forward leaning inversion, you only hold this position for about 3 to 4 breaths, so about 30 seconds or so. And if you have any problems with your blood pressure, glaucoma, or heartburn, going upside down may not be best for you, so check in with your provider first. Also, if you are planning on having a natural birth and want to be as prepared as possible, then click the link down below for more info on the natural birth blueprint, or just schedule a call with me to see how I can help you prep for birth. So remember that fetal positioning is super important for smooth labor and birth, as baby has to engage and rotate in your pelvis. Hopefully this video was helpful for you to have a better understanding about fetal position and how it influences labor. Also, make sure to tune into next week's video, because that's where I'll be sharing my daily routine to help baby find a better position for birth. Thank you so much for watching, and I'll see you in the next video. Happy birth prepping!